Hi, I'm 37 weeks pregnant and I decided to come to the chiropractor because I've been experiencing some other issues that I don't know if were brought out by the pregnancy, but I have Meniere's disease, and back in July I started getting extreme vertigo, and it's prevented me from driving, and I've been very nauseous and been throwing up because of it. You know, the room gets very spinny, and I've had a lot of fullness in my ear, and even some ringing in my ear occasionally. And I also have TMJ in my right jaw, and it's my right ear that seems to be the issue with the fullness. So I'm here for that reason, and also to I think help with the labor part, hoping that it's a little bit smoother and that the baby's in a good position to help with that.
Right there. Right there. So the first thing we're going to do is stand up our patient, okay, and where we see there's a lot of swelling right over here, okay, considerable amount. And even though it seems like overall tightness, okay, tight over here, tight over here, tight on the left side, not so tight on the right side over here. So we're going to take a look, and even though you complain about pain right here, I want to take a look, see what's going on. So let's check the foundation first. A little tight on the left. So you can move on to the right. You feel that difference there?
Mm-hmm.
Tight, loose. Left hip. Okay, a little stuck on the right. Going backwards, no problems. I'm sorry, stuck to the left. Left hip. Pushing forward. Your right hip moves forward without a problem. Goes backwards without a problem. So we're going to take a closer look, see what's going on over here.
Okay.
Okay. Because we don't have x-rays, okay, so we have different ways of assessing and determining if there's any structural abnormality in the pelvis. Okay. So go ahead, march in place. What I want you to do is knee up to this waist level, if you can. Good. Put it down. Okay, that moves fine. Okay, march. So see, that's stuck. Okay, so put it down. Okay, so guys, so what we're looking at right now is this. Normal, the thumb should move downwards without a problem. Okay, abnormal, it won't move as much. Now for the sacrum over here, it should move inwards. Okay, abnormal, it'll be stuck in place. So we see over here, demonstrate once again, right foot, it goes up. Okay, once more again. The thumb goes down without a problem. Go ahead. Now left. Okay, go ahead. Once more. So the left thumb, no problem. So the sacrum and the ilium on her right hip, not a problem on that side. Now we're going to do this side. So go ahead, raise this one up. See? So her left hip, without a problem. Now go ahead, right leg. See, it doesn't move as much. Go ahead, drop it down. Once more. Okay. Go ahead. Left hip. Right hip. See, it doesn't budge. So this is where the problem is, and that's what we need to correct on. Okay? Okay, so the next step what we do is the Webster protocol. We're going to check the foundation itself. So compare the feet. Raise it up. No, let me do it. Okay. So this one on the left side you feel much more tighter, right?
Yes.
Compared to the right one?
Yes.
Okay. So that helps confirm. Okay. And yes, got a left sacrum problem. That's what we need to correct on her. First thing we're going to do is we're going to pump this up, okay? And we're not going to do a very big thrust on this fellow over here. Because again, you're releasing that hormone called relaxin. And what that's going to do is it's going to relax your pelvis over here. So what we're going to do is we're just going to pump it up and just give a little nudge and see if that's enough to do it. If not, we'll give a little thrust right in there just to get this structure properly corrected and proper alignment. Make it a much more easier birth. let's see. How's it now?
Better.
Better, right?
Yeah.
Okay. Meniere's disease is a multifactorial problem. So let's start off with the first component, the inner ear. Okay. Now, with the inner ear, there's two components of it. One is dealing with the auditory part. So if the nerve is not functioning properly as well as it should, that's what's giving off that tinnitus or that ringing sensation in your ears. Other component, okay, that deals with your sense of balance, okay, the vestibular part. So if that nerve component is not functioning as well as it should, that's what's giving you that little dizziness sensation, the vertical component. Now, other component that deals with Meniere's disease is also fluid in the ears. Okay, now that's a different nerve. That deals with the cranial nerve number 5. Now, the cranial nerve number 5 deals with a lot of stuff, but in your guy's situation, it also innervates the soft palate of the mouth, meaning the very top part where your tongue is. Okay, I'm sorry, the roof of your mouth. Okay, that's the soft palate. The nerve's supposed to innervate that. Now, we have a drainage tube from the inner ear, okay, that's supposed to drain out and go through your mouth. You can tell because when you take a look in the mirror, okay, you see it right in the back, if you lift up right in your mouth and see there's a small little hole here, a small little hole here. That's the eustachian tube. Now, once again, if the cranial nerve number 5, if that's not functioning as well as it should, and the soft palate is not working right, it could cause it to collapse, resulting in one or both of the eustachian tubes to be pinched off, not allowing the fluid to drain out of the inner ear. So that gives you that fluid in the ear sensation. So now here's the deal, okay? What we find for to resolve and help with Meniere's disease, first cervical, second, third, and the 5th cervical. So we're gonna do a structural test to determine which one of these fellas is causing the problem, and we correct that. Feel that tendon right there, huh?
Yes.
Yeah. That feels like your third. That's your 3rd cervical. Okay. Now I could tilt your head. I'm sorry, rotate your head over to the left. Is that difference right there?
Mm-hmm.
It's a little stuck on the right side.
Yes.
Right. I could tilt your head to the left without a problem. Feel that difference right there? Stuck on the right side.
Yes.
Right. So the 3rd cervical, that's what we identified. So this was over here. That's what we need to fix on. Relax the right shoulder. There we go, right. It's better. You feel the difference now?
Yes.
You could really tilt your head now, right? Not all the way. Feel that difference now? Your 3rd cervical?
Yes.
Tilt it more. There's still some residual fixation in there, okay? But it's not perfect.
Right.
But you know what? For first time, especially without x-rays, okay?
Yeah.
Right, I want to take this as conservative as possible.
Yeah.
That's all we're going to do for that area right there.
Okay.
This is not going to be an on and off switch. That's why I mentioned somewhere usually between 2 to 6 visits is when the resolution happens, typically.
So I have been experiencing vertigo the last 2 months. The last episode though that I had was September 2nd going into the 3rd, with a lot of like fullness in my ear and just very off balance for about a day and a half, and I have not experienced that at all since I've come here. So I'm very hopeful that this is going to help a lot of people.
All right, thank you very much.
Yeah.